Hello everyone and welcome to a new episode of Majlis podcast by Emirates Hospital Group. My name is 𝗠𝗷𝗶𝘀𝗀 and I'm a family medicine consultant at Emirates Specialty. Today it's a pleasure to have my colleague Dr. Sadaf, who's going to talk about puberty and in particular early or precocious puberty. Dr. Sadaf?
Thank you, Dr. Vail, for having me here today. I'm Dr. Sadaf Siddiqui. I practice as a specialist pediatrician at Emirates Hospital, Motor City. Post my training in pediatrics, I had my training in pediatric endocrinology in India. I worked at renowned hospitals there and have an experience of over 10 years. I moved to the UAE in 2022 and have recently joined the Emirates Group.
Welcome to the group, and it's a great pleasure to have you at our podcast, but also at our hospital group. We're going to talk about puberty. We hear people a lot going through puberty and puberty changes, but one thing that people always worry more about or they don't understand much is early puberty or precocious puberty. How do you define it? How do you approach it?
So precocious puberty or early puberty is defined as the onset of puberty or development of secondary sexual characteristics prior to the age of 8 years in girls and 9 years in boys. The earliest sign of puberty in girls is 𝗘𝗺𝗶𝗍𝗀 or breast development, and in boys it is the appearance or increase in testicular volume. This is followed by 𝗘𝗺𝗃𝗀, which is the development of axillary and pubic hair, a change in body odor, a rapid increase in height, and followed by menses in girls. A common misconception amongst people is that puberty is synonymous with menstruation, but menstruation is actually the last part of puberty in girls. And we need to evaluate precocious puberty early for various reasons. Firstly, in case we need to find out if there's a pathological cause associated because of it. Second being, precocious puberty, if it is untreated or uncorrected and progressive, it can actually cause bone fusion and early acceleration of the skeletal muscles, bones, which causes a delay or a shortness of the adult height or predicted adult height for the child. Hence, it's important for them to reach the genetic potential. Third, and an important factor being psychosocial. When children and girls and boys as young as 6 and 7 years of age, they experience these symptoms, they undergo immense stress and psychological changes which are difficult for them to accept.
Especially that their other friends and schoolmates are not going through those changes.
Yes, but there's too much of peer pressure also. They're not able to adapt themselves to these things.
So obviously it's quite important thing to diagnose and to kind of address correctly. But let's talk about causes, because you mentioned that kind of like it's kind of diagnosing it and treating it and all of that. Maybe we'll address it in a few minutes if you don't mind. But what are the common causes and what do parents should do or notice before they come to you?
Okay, so firstly, precocious puberty can be classified as central or it could be peripheral. Now, central meaning it is early maturation of the HPG axis, meaning it's the normal pubertal phenomena, but which is coming in pretty early. In girls, 90% of the time it is idiopathic, or we don't know the cause. Yes. But in boys, 50 to 60% of the times it is due to some pathology. Now, pathology could be a CNS insult, like a brain tumor, an infection, post-radiation. It could be so many other reasons. Also, we have seen, especially post the COVID pandemic, there's been a rapid increase in the obesity in children. So this increase in BMI, it stimulates a hormone called leptin, which indirectly activates this HPG axis. And also there are certain chemicals like chemical compounds in cosmetic industry or phthalates, which are actually endocrine disruptors. They disrupt the internal milieu of the environment of the endocrine system. And hence these all promote early puberty. Coming to peripheral puberty, which is due to the peripheral organs, increase in sex hormone, which could be inside the body, for example, like adrenal tumors or adrenal hyperplasia, or it could be exogenous. Exogenous meaning coming from outside. Like for instance, an accidental application of some sex steroid cream by a child that could stimulate these pubertal hormones.
It's quite a varied number of causes, but what matters is basically to seek help and talk then to the expert.
Yes.
Because it could be, like you said, idiopathic, but also it could be, God forbid, as serious as a cancer, especially in a young boy.
Yes.
Obviously, the signs and symptoms, and you said it's the development of certain sexual traits. As a parent, what should I watch for as a symptom? As a doctor, what do you define as a sign when I bring my child to you?
Okay, so for parents, what I would say is for girls, there is 𝗘𝗺𝗶𝗀 or breast development. Girls as young as 6 and 7 may complain of breast pain. For boys, there is increase in testicular volume, which is difficult for parents to assess. But what they can watch out for is a rapid increase in height, or like a change in shoe size, or parents complain that doctor, we need to purchase new pair of clothes very frequently for the child, or there is a change in the body odor of the child, or very clear signs are development of axillary or pubic hair. So when you notice these symptoms in children, you must come and seek the help of a specialist for the same.
And do you mind reminding us about the age? Because you mentioned 9 years old and below for boys. Am I wrong, sir?
Yes, prior to age of 9 years in boys, if you're noticing these changes, you need to come and evaluate. And prior to the age of 8 years in girls, this is the classical signs, time frame for which you need to be watchful for. A good thorough clinical examination is needed first to ascertain whether there is actually true puberty. Then we go on with the further testing. For example, it would be a bone age or the hand X-ray, left hand X-ray we take. And if there is any advancement in that, we know that we need to delay the progress of this bone age fusion. And then we do certain blood tests like gonadotropins like LH, FSH, which are increased, that it means it's central puberty. And if there's increase in estrogen and testosterone, it means there is peripheral precocious puberty. For other causes, we could do an MRI of the brain to see for any brain tumors, or an ultrasound of the ovaries and testes to see any tumors or any infections there.
So like any condition that we might escalate, but not every child, of course, will get all these investigations. That's where, like you said, the history and the specific complaint of each, or the presentation of each child. Because the way I think about it, I always say, okay, if I'm a parent, I'm a bit worried about my daughter or my son at certain age. I bring them to you. I'm trying to prepare my child to say, well, listen, the doctor is nice, the doctor is going to do that. Should I prepare them for a blood test at least, or just an X-ray? Or do you think MRI and the further investigations or the advanced ones will be definitely part of the workup?
No, we basically begin with a good thorough clinical examination, followed by usually the first test is a bone age. That's a simple hand X-ray of the left hand. And then depending, we will do a basic blood test to see if there is central or peripheral, and the further testing will only be based on the report.
Fair enough. And if my child comes to you and they get a blood test, are you going to give them a sticker?
Of course, I
Perfect.
will.
That's very good. Perfect. Now, I love obesity. I love dealing with obesity. You touched on a very sensitive topic for me when you mentioned leptin and you mentioned obesity in kids, which is unfortunately the true pandemic happening in our world today. How do you address it? And you mentioned how it's related to precocious puberty, but what's your approach to dealing with this pandemic in kids now?
So as we have seen post-COVID pandemic, the increasing incidence of obesity, it predisposes to stimulation of the leptin hormone. And also it causes insulin resistance in children, which actually indirectly stimulates the androgens or the sex hormones. So all this will lead to increase in coming in of early puberty. So children may not know that they are already experiencing these symptoms. And for parents, it's difficult to assess because they just feel my child is chubby or fat. Like for example, mothers come to my office complaining that, doctor, there is breast development. But when I actually examine the girl, it's nothing but fat or lipomastia. So there's a very thin line wherein, we need to have a good clinical examination to know whether there's actually precocious puberty or it's more obesity masking these symptoms.
Of course. And that's a very good point, actually. And thanks for highlighting it to link the both together. And a lot of patients, when they hear the word insulin resistance, they jump into diabetes. Whereas what you're saying, no, it's just the hormonal cascade in the whole body starting affecting each other. And then the androgen are part of this cascade.
True that. So hence there is a very important need for children to be very active physically. I usually tell my patients to make sure the children are spending 1 hour outside after the school, or enrolling them in extracurricular activities and making sure they're physically active for 1 hour a day for at least 5 times a week. Because this insulin hormone, it's basically a hormone. It's going to cause some resistance because of the excessive buildup in the body with eating all junk outside and not moving themselves. It's going to predispose them to become obese, and which in turn may activate the whole HPG axis and push them for early puberty.
So in a way, saying no to my child every time she wants a sweet or a treat or a snack Does it make me a bad parent?
No, it doesn't. Now we have to make them understand what is healthy and nutritious eating. So giving a simple chocolate maybe once a week is fine. I mean, we can always have our reward days, but not giving them on a daily basis, definitely. And eliminating carbonated drinks and juices and push them more towards nutritious food like whole fruits or eating a balanced meal with good enough intake of proteins and carbohydrates, giving good fats like nuts to them daily. That would be a more healthy option.
We talked diagnosis, we talked symptoms. What about treatment? I mean, not to be doom and gloom, but everything has a solution, of course. So, I mean, of course, if we hear the word brain tumor, I'm sure a lot of parents start worrying today and looking at their young child to make sure that they don't have any worrying symptom. But I'm assuming, like everything in medicine, there's a solution if needed.
Absolutely, Dr. Vail. In this modern science era, there's treatment for everything. And this condition is also very easily manageable. So firstly, we need to find out whether it is central or peripheral. For peripheral, of course, if we know that there is an adrenal hyperplasia, there is medications available, or if it's an adrenal tumor, there is surgery for it. Coming to central precocious puberty, which is the more common one these days, that is the normal puberty which is happening early. But we need to treat it because we need to delay the bone fusion and give more time for the child to grow. There are injections available which are called gonadotropin analog therapy, which could be monthly, it could be 3 monthly or even 6 monthly injections. And a thorough periodic monitoring is done on this therapy, which is a very safe and effective therapy going on for the last almost 40 years. So we have robust experience with the same. It's a safe therapy and we do frequent monitoring for it.
Perfect. So I guess the main thing is that watch your kids, make sure they're happy, they're active, but at the same time, if you have any warning symptoms, come talk to Dr. Sadaf.
Yeah, a simple message that I usually give to all my parents and especially parents with kids aged between 6 and 8 years would be to watch for these signs and symptoms. Also to increase their physical activity, have a thorough, regular clinical examination by your doctor and give them a balanced, nutritious diet. Thank you.
Dr. Sadaf, you've made a very complicated topic and very sensitive, I may say,
Yes.
because development of sexual characteristics in a child, they're always sensitive for parents, but you made it very simple, and thank you very much for that lovely summary today. It was a pleasure.
Thank you so much, Dr. Vail.
And this brings an end to our episode today. Thank you very much for listening, and please stay tuned for another episode very soon of Al Majlis podcast by Emirates Hospital Group. Thank you.